1027, 1035, WICY, feel-good favorites from the 80s and more. Hello, it's John Kazar hanging out with you, and right now we dive inside the community as we always do on Wednesdays, 9:40, an update out of Hyde Medical Center. Dr. Lisa Mark with us. And Lisa, how are you?
I'm great, John. How are you?
Doing very well. Today we're going to start off by covering the recent changes to your and Hyde's welcoming policy. Go ahead.
As the Delta variant has ramped up across the region, Hyde has moved pretty quickly to preserve the health and safety of our patients, our people, and our facilities by backing up and returning to the policies and processes that we know are effective at slowing the spread of COVID-19. The masking, social distancing, testing, and eliminating the use of our patient waiting areas. So it might not seem like it, but it's a lot of change in a short amount of time, and we definitely want the patients in the community to understand what's happening, why it's happening, and what they can expect when they come to the hospital.
Right, like the welcoming policy and the details of it. What should people know?
Right. So most people have probably heard by now about the changes that we recently made regarding visitors and support persons for people receiving both outpatient care and our inpatient care. I want to just take a moment to review those changes and talk a little bit about the why.
Mm-hmm.
So we continue to have visiting hours for our patients and families, and visitation is one of the most impactful things we can do for those in our care. We did revise our policy to limit the hours, and we've reduced the total number of hours to 4 hours each day from 10 to noon and 5 to 7. And we've also reduced the number of visitors that some patients can have at one time while in our care. Our outpatient clinics have also closed their waiting rooms as we work to limit the opportunities for both patients and visitors, support persons to come into contact with each other while at Hyde.
What can you tell us about employee PPE use?
So I want to mention that because it's a change that's very visible. We saw it last year that patients and visitors were really interested in why our frontline staff began wearing the eye protection and other articles of PPE or personal protective equipment. Part of our recent changes is we return to now all providers and everyone patient-facing is to wear their eye protection again, regardless of whether they are vaccinated or not. We use both face shields and goggles. So patients and visitors are going to start seeing more of that when they arrive at the hospital.
Yeah, and those common areas not certainly going to be flooded with people, right?
Right. Another big change, it's the final thing I wanted to talk about today, is that we are eliminating the use of our patient waiting areas, the waiting rooms, the surgical waiting areas, etc. Again, it's a big change, and we made it because we know that that really works when it comes to keeping our hospital safe and healthy and limiting the spread of the virus.
Right, absolutely. Dr. Lisa Mark with us. Anything else you want to add?
No, I think that's it for today, John. Thank you so much.
All right. We appreciate it so much. Wednesdays, 9:40, updates out of Hyde Medical Center. It's 1027 and 1035 WICY. Feel-good favorites from the 80s and more inside the community.